Welcome to Raise the Line with Osmosis from Elsevier, seeking solutions with leading experts on how to increase healthcare capacity so people can get the care they need during the pandemic and beyond.
Hi, I'm Shiv Gaglani, and today I'm delighted to welcome two leaders in oral healthcare to Raise the Line. Laura Skarnulis is CEO of the Dental Assisting National Board and the Dale Foundation, and Ann Battrell is CEO of the American Dental Hygienists Association. I first met Laura actually when she used to work at the American Board of Medical Specialties, the ABMS, which is one of our close collaborators and has been for many, many years. And we share many connections, including people like Dr. Lois Nora, who's a personal friend and mentor of mine. Today, I'm looking forward to hearing about their organizations, current trends in oral healthcare, and getting their insights on the state of the oral healthcare workforce. So Laura and Ann, thanks so much for taking the time to be with us today.
Happy to be here.
Thank you so much. Great to be here.
So what we do for our audience is to set the stage, is to first ask a general question about kind of how you got started in your careers and what got you interested in healthcare, and then specifically oral healthcare. So maybe, Laura, can you start us off?
Sure, I'm happy to do so. So I've been at DMB, the Dental Assisting National Board, and the Dale Foundation now just over a year. I came here in August of 2021 after you mentioned I was at ABMS, the American Board of Medical Specialties, for about 8.5 years. Both organizations serve as certification organizations for healthcare professionals. And really that is something that my interest in healthcare and my interest in working with organizations that have a purpose stems back to probably 20 plus years ago. I started my career in public accounting and went into corporate. And then I ended up taking a different path and went into organizations that were really making impacts in communities. And I found that by connecting my work to an organization's mission and giving back to their communities or the patients that they serve is something that's really important to me, and where I can really thrive and do better work, I feel personally. And really over the last year or so, DMB and the Dale Foundation, we've implemented many initiatives where we are affording the opportunity for people to increase access to care, or as a professional, increased certifications and other educational opportunities for those professionals to continue to advance their own careers.
Yeah, and absolutely. And that's something we've related on for many years, is the scale of the impact and being very mission driven with what you did at ABMS and now clearly what you do at Danby and Dale. So Ann, how about you? Can you give us a bit of your career highlights and what led you to lead the American Dental Hygienists Association?
Sure. A lot of my journey in oral health and healthcare in general started because I came from rural America, rural Illinois, where the caries rate, the dental cavities rate, was very, very high. We had one dentist for the entire town, and he happened to rent from my dad. So I was able to get that entry-level position, as a high school kid, and began the journey of learning oral health care. The dentist's wife, ironically, her name was Ann, and she became my very first mentor. I thought what she did as a dental hygienist was so cool. She was the lifeblood of the entire practice, and I just loved her. So I learned from her as much as I could. So when I was just 17 years old, I had graduated from high school early. So I decided to apply to dental hygiene school. So I did. I applied early and I got into Northwestern University, and I said goodbye to rural America and came into downtown Chicago. So the student membership in the American Dental Hygienists Association was something that our faculty always stressed how important that was for us. So I had no idea what that meant. I was a 17-year-old kid, but I knew how important the organization was. And so my professional ethics required me to support it. Little did I know, like 30 years later, I would return to run the organization as CEO. So it was a great opportunity. While I was there, in my first 2 years at Northwestern, they didn't have a baccalaureate option. But in my very final year, before I became a hygienist, they started a baccalaureate program. And they asked me and 4 of my classmates to come into the program kind of as guinea pigs. And they tried every single thing they could, threw a lot of different opportunities at us, and asked for our feedback all along the way. So I became very much a lifelong learner, which is really important to me, even in the role that I play at ADHA today. So I practiced for a while. I taught dental hygiene for a while. I did some corporate work for a while. So I had a varied career, which I'm going to talk a little bit about, Shiv, throughout our podcast today, about how important the variety is in your career, as Laura's already talked about what her variety was. I obtained my master's degree in dental hygiene from the University of Missouri, Kansas City, just a few years ago. And I was also a guinea pig in that program. So I did all of that online when online was first becoming the popular norm. So I got very involved in online education and found that it works. So on the ADHA side, I became president of the association in 1996, 1997. And then after that stint, I was asked to join the staff as a manager of dental hygiene education just a few years later, and then became the CEO about, believe it or not, 20 years ago.
Wow, that's incredible. I love how your story began with a very personal kind of interaction with dental hygienist, also named, who kind of worked out of your father's rental office, to now leading this large organization. My personal story in connection to the dental field, as Laura really well knows from all my times visiting Chicago, is my sister and brother-in-law, Dr. Shiv Gaglani and Abhishek Nagaraj, are dentists who have half a dozen dental practices in the Chicago area. So I've gotten to know many of their staff, including dental hygienists and dental assistants, over the years. Now, for our audience, many of whom started off as medical students and nursing students, but increasingly we're reaching dental schools and dental students and dental hygienists and dental assistants. Can you give them a kind of a sense of the organization, membership, and missions, as well as the kind of the growth rates of, maybe let's start with you, Ann, and go into the growth rates of the dental hygienist career, and then transition over to Laura to talk about dental assisting?
Yeah, the profession of dental hygiene pretty much grew exponentially over the years until COVID hit. And when COVID hit, we saw a great number of hygienists, about 8% of the population, literally left the profession. That might have been the cohort of people who were pretty close to retirement anyway and had made the decision that this was time to go. There was a lot of concern about availability of PPE, just as there would be for dental assistants. And so we saw this growth in dental hygiene occur, but then COVID hit and everything declined. We're back now to about a 4.9% of the profession still, hasn't returned, but we hope that that continues as more and more hygienists and assistants feel confident of the safety of their dental practice, because many of them are moms and dads and they're worried about taking things home to their kids or to their parents who they may be, having in their homes as well. So there's about 15,000 members of ADHAs right now, and that includes student members. So our mission really speaks to them. It's supporting the career paths of dental hygienists, no matter what career path they may choose. But we've gone, through so many changes that it's really important, particularly with governmental agencies, Shiv, that dental hygiene speak with one voice. So ADHA is that voice to say this is where the profession stands on a number of issues, especially healthcare issues today, which are numerous. So we work to help our state associations pass legislation that allows dental hygienists to practice to the top of their scope of practice, not at the bottom, but at the top, just like dental assistants. Let these educated healthcare professionals do what they're educated, certified, and trained to do. So that's a big role of ADHAs, is to help our state association advocate for the top of the practice, scope of practice.
That's really helpful. And definitely before we even started the podcast, we talked about that theme of scope of practice, which is not just occurring in dentistry, but also in medicine and nursing and many other fields. And so let's transition over to Laura. Can you talk a bit about, both Danby and the Dale Foundation and kind of the mission and any salient points that you'd like our audience to know about them?
Yeah, absolutely. So, one of the defining differences is that we are not a membership organization. So we are the certifying body, and we are a national certifying body for dental assistants. And we also administer exams for dental assistants that may become certified or are using these exams to become certified, or might be using our exams to meet state requirements, or to just maybe get some portability in areas where they want to maybe go into various different areas within their career or across the country. One thing I think is important to point out, and building upon what Ann said, the last several years have been it has had such an impact on the profession as a whole. Dental assistants as well have been leaving the profession, some retiring. There are about 380,000 dental assistants practicing, or at least there were prior to the pandemic. We had about 37,000 of those certified, and there's reasons for why there's not as many certified as there are dental assistants. And the main reason is that, one, it's not required. Two, is that the states have so many different dental practice acts, and there's nothing uniform about it. Unlike medicine, where you have state licensure and then you have certification, in the world that I came from, Shiv, before, this was an eye-opener for me. It was like, well, of course you would get certified, because that's the highest standard of quality, and we have a lot of work to do in that regard. But it is recognized as such a portable national professional credential for dental assistants that and there's a lot of interest and I think momentum to move in that direction. However, we did have people leave the profession because when they come into the profession, the compensation is not necessarily where you would expect it to be for individuals that are highly qualified, highly educated, coming through these training programs for it to be. And work is being done on that as well. Many of our dental assistants go on to become hygienists. Many of our dental assistants go on and start looking at going into dental school. So it can be an entryway into the dental profession for many people who don't have it in their family or are aware or have it on their radar that they want to come into dentistry. I think the area and to build upon what Ann was saying too, through COVID, one area where we did see growth was in our learners. So our Dale Foundation offers educational offerings for not only dental assistants, but oral healthcare professionals as a whole. And the educational offerings grew exponentially through COVID. And this could have been, we're still digging into the reasons why for this, but what we're seeing is that because our educational opportunities are either training materials, exam preparation materials, continuing ed, or we have some new certifications that we launched. So are people expanding their knowledge base? Are they going in and learning more to advance, to make shifts? We don't quite know yet, but we saw such growth, and people had time. As Ann said, when the lifelong learner in so many people and what's required in a oral healthcare profession, it's hard to find time for that. So we also recognize that during COVID, when some of these practices were not open, that people did take advantage of that opportunity to grow and to learn. I do want to just take a minute though. So about the organization and the mission. But really, what does a dental assistant do? And I think I didn't have a lot of knowledge of the understanding of what the dental assistant does in the practice and the integral part that they and the member they are of the oral health care team. So it's a very dynamic role with a lot of variety. They're responsible for patient communication, greeting and seating the patients, tending to their needs during an appointment. But here's a really important piece of it: the communication of the post-care instructions for everything that comes after the appointment. It is shown that when you have a dental assistant that is part of that team, that the patients who have a dental assistant explain those post-care procedures for them, they actually adhere to those instructions. I don't know if it's because it's more relaxed. It's not the dentist talking to them, but they can relate to the dental assistant, and I think that they feel more comfortable. Also, they sterilize the room, the instruments for treatments. They take dental radiographs, and then they assist the dentist with many procedures. Quite frankly, some of the discussions we're having with many of the organizations are doing some studies on efficiencies to see how much more efficient dental practices are that have dental assistants, and to Ann's point, that are practicing at the scope, at the top of their practice and their abilities and their competencies, because some now, not just now, but they along the way, they can perform some expanded functions, whether it be restorative or preventive care. But that's an additional education and training. But really having them as part of the team and valuing them as part of the team is such a great opportunity for individuals to be in the profession, be in oral health care. And quite frankly, what many of them are saying is that we've done some surveys recently, and we have some data that will be coming out in the fall, but many find it to be a rewarding and fulfilling profession, and it meets their lifestyle needs. So some of these professions that you go into in oral healthcare, or any, and not just oral healthcare, in any healthcare, you might not have as much, I don't want to say you have control of your schedule, but it's not necessarily late nights every weekends working on Sunday. There's the opportunity to make some sort of flexible schedule as well. So great opportunities within it. And, we're working with a variety of stakeholders within the oral healthcare community to see what we can do to make sure that we can get even more dental assistants prepared and ready to be in the workforce.
I love that. I mean, there are certain key topics you mentioned there that I'd love to pull on. One of which is this career laddering that's evident in the dental profession, oral healthcare profession. Certainly, the nursing profession has a lot of this, where there's clear pathways for people to go from associate's degrees to bachelor's degrees, all the way through doctors of nurse practitioner degrees. And we see that, you meet in DNP who often started out as an associate's degree. So it's really good to hear that sort of career laddering occurs with dental assistants, dental hygienists, and dentists. We talked about scope of practice a bit, or you both mentioned that. I'd love to hear, obviously our audience primarily is familiar with medical and nursing, increasingly so with dental. In the PA profession, as an example, there's surgical PAs, and there's further kind of segmentation of that field itself. Laura, you sort of alluded to this a bit, but I'm curious if either of you can comment on sort of the stratification of the various careers in oral healthcare, and more of that kind of scope of practice, so people can operate. We can basically make sure the right skill set is matched to the right part of the patient journey. As you mentioned, Laura, the fact that dental assistants are being trained and being assessed on their ability to communicate to the patients, to provide post-discharge instructions, that's essential, because the average time a dentist is able to spend with a patient has been decreasing over the years, same with physicians, et cetera. So can either of you comment a bit about kind of the stratification of more careers in oral healthcare, as well as any career laddering considerations?
Yeah, I like to use a different symbol than a ladder, because a ladder says, oh, I'm at the top or you're at the bottom. I like to think career options as a web. So people can go laterally, they can go on, they can make all different kinds of choices today that never have been there before. Especially when we see, Shiv, this medical dental integration occurring more and more frequently. So when you think about why on earth does it seem like in our healthcare system, the mouth, no pun intended, was extracted from the rest of the body? when we know, in fact, that most diseases have some type of sign or symptom first in the mouth. So if you're a dentist, a dental assistant, a dental hygienist, you've got to know like this complete integration with medical if you're going to be a healthcare provider who is practicing at the top of their scope now. So the diversification, at least in hygiene, and I think it's going to happen in assisting as well, one of the options is dental therapy. Dental therapy is been described as akin to a nurse practitioner, kind of in between that dental hygienist and a dentist, where the scope is different. The scope allows some of the more dental procedures that aren't as expansive as the other end of the services that dentists provide. So we've seen that first take place in many states like Vermont, first happened in Minnesota. We're seeing other states pass legislation that's called direct access. So what that means is a state would allow a dental hygienist to provide services directly to the public. And sometimes they do have a designation that would signal to lawmakers and regulatory agencies that a hygienist has received this additional education in order to be a direct access provider. My master's degree was on a group of hygienists in Oregon called limited access providers, or LAPs. So I chose to study them to get the information into the scientific literature about what they do and what kind of services they provide. So that diversification that happened in medicine many years ago is now happening in the dental space. You're seeing more hygienists be employed in hospitals, in pediatricians' offices, in long-term care facilities. So that is a trend that's not going to stop. It's just going to continue to grow.
I was just going to build upon that. And Ann and I talked about this a bit when we were together in July about the opportunity to improve the access to care.
Right.
By getting hygienists and dental assistants into the community. And I think the ADA has a great example of this. So the American Dental Association has a community health coordinator program that they've done. And really what this is that they are often hygienists or dental assistants, and they are trained to help people access dental services and care. They build bridges, from the community to dental clinics by removing the barriers to care, such as transportation, health literacy, language. Dental assistants can serve as case managers in these type of situations. And we know that case managers are a highly effective model in medicine, and with these care homes, they're integrating both dental and medical care. And often in these situations that these individuals work in the same communities that in which they live. So they're seen as that link, and that they're linking to their communities to these opportunities together. I spent years at United Way before I even came to ABMS, and United Way of Metro Chicago has a health initiative. They have 3 pillars of their impact areas. It's financial, education, and health. And they go into communities with other organizations and build wraparound services to increase not only the access to care, but the education about preventative care and getting that to them. I think there's an example of a program that we work with, talking about how building in the various members of the dental team is so integral to making sure that that's a high performing team. And that's through Temple's post-baccalaureate program. So they have a post-bac program for students that are looking to get into dental school. And they actually require those post-bac students to take or become NELDA certified. And that's one of our certification. It's the National Entry Level Dental Assisting certification. And what that is, it's education and training for somebody to come into the field at the entry level, and their future dental students dentistry students are serving, they earn that certification, but then they actually serve as dental assistants in their dental school, and their dental schools is clinic at Temple providing to the community. So for me, it is just this wonderful culmination of getting the dental students familiar with using dental assistants, because from my understanding, and I'm not an expert in this, but four-handed dentistry, meaning the dentist and the dental assistant education, that has not been practiced of late. So this program actually provides for that to happen. The dental assistants or the future dental students are working in the clinic and then giving back to the community, improving access to care. For me, it's a win-win all the way around. But really, the integration of medical and oral health care, it's becoming much, much closer. We're talking with various organizations about how we can increase the access to information and education, and what transcends all of it that we need to know together to improve the profession and ensure that people are qualified to work. And I like what Ann said about this being a web, because when you broaden your perspectives and broaden your knowledge base, that provides you so many more opportunities to take your career in different directions that you might not even thought possible.
Correct.
Yeah, all those are really great points, especially the social determinants of health and dental assistants as case managers, dental hygienists, as well. How, we can also get these students who may be in programs like dentistry programs also training up as dental assistants. I know in the medical context, we have a lot of partners who the first thing that students have to do is become a scribe, or they have to become a EMS or EMT, which gives them a lot of empathy and lets them work in the care coordination much better. And I love the fact that the link between oral healthcare and general healthcare is so strong. We've had guests like Sachin Jain, who's the CEO of CareMore, and now the CEO of Scan Health Plans, who did a lot around how do we bring preventative medical care, hypertension screening, diabetes screening, to the dental office. And certainly dental assistants and dental hygienists are integral parts of that. I'm also aware of your guys' time, so just a couple more questions here. The first is, we talk a lot about the shortages we have, especially post-COVID with moral injury and burnout of physicians and of nurses. There's other camps that talk about not so much a shortage, but more a distribution problem of where these people are located. And you mentioned you come from rural Illinois. So certainly a lot of rural and home healthcare trends going on right now, virtual care as well. Can you talk to us a bit about dental assisting, dental hygienists, and maybe dentistry too? And are there shortages, or is it a distribution problem? Do we need tens of thousands, or hundreds of thousands more people to be trained? Any commentary on that would be great.
Yeah, I'll jump in on this one, because I will tell you that we had a meeting with members of ADA councils last week, and the prevailing sentiment is we need dental assistants, and we needed them yesterday. Dental assistants, they are in high demand, and for the reasons we've stated earlier. The profession is going through, I would say, a shift, and as people look at dental assisting possibly as a entryway into the profession and moving into other directions, the traditional dental assistant role, I think, is becoming, there's more openings for a variety of reasons. But we certainly know that there is a shortage, and the reasons for all of that shortage, and there has been for years. I think it ebbs and flows, but I can tell you what we're doing to work on it. And one of the things I mentioned, that we have the certification for entry level. We're building a curriculum and framework to train dental assistants starting in high school. And we are going to be starting awareness in middle schools for dental assisting. And we are piloting this framework in 2 different states, in North Dakota as well as in Michigan. North Dakota happened because of need, and Michigan happened because of capacity. And so we're learning from those opportunities, and then we will be bringing that to scale in early 2023. And we're very excited about that. We also think that that framework could be utilized by dental practices, and they can take pieces that they want to train their dental assistants that come into their offices and provide for quality care. We also brought together stakeholders in early July, and Ann was part of that. Thank you again, Ann, for your participation and engagement.
Happy to be there.
We had about 20 organizations talking about the future of oral health care. And in particular, we were very interested in the future workforce of dental assisting. And we identified some initiatives, and one of them was to form a workforce coalition with organizations throughout the room and others that weren't able to be there, and really put efforts in forward to come up with tangible solutions, increase accessibility to the programs, look at our requirements and how do we modernize them, and to reach dental assistants across the country and make sure that we have the right representation from all groups, rural, diverse group, all segments of the population that are being served and that are in the profession.
That's awesome. Thanks for sharing all that. And it's great to hear that there's so much coordination behind the scenes between all these different levels, groups, and it's very complicated. Obviously, I knew this from ABMS with all the 32 member boards and the state federations, medical boards. There's no reason that it wouldn't be as complicated or more complicated in the oral healthcare sphere. You mentioned curriculum, and I know, Ann, you've taught. You were a dental hygienist. You taught dental hygienists. You've gone through several layers of education. Osmosis is a teaching company at its heart. I'm curious if you could snap your fingers and teach any stakeholder, whether it's the general public, middle schoolers who may be interested in careers in dental hygiene or dental assisting, whatever stakeholders you have in mind, what would you teach them and why? Like if Osmosis could develop a video or a course, what would it be on?
Yeah, I think the health literacy, the oral health literacy, how important your oral health is to your overall health is something that, even though I'm surprised to hear it every single day, the general consumer is relatively not too knowledgeable and what that link really is. So a couple of years ago, we did a collaborative project around getting consumers to understand, particularly in children in low-income families, that brushing twice a day with a fluoridated toothpaste was an important factor for their children's oral health. The number of caretakers, parents or grandparents or whomever, that had no idea that if you just help your child develop the habit of brushing twice a day with a fluoridated toothbrush could save them years of dental pain and dental care needing to be done. And the caretaker really didn't know, just didn't know. So we're continually reminded to go back, Shiv, to a basic message. Often we in the dental space, Laura would know, I'll take full responsibility too. We complicate the message so much. We go to like a college level education when you're really talking about oral health care. It needs to be like at a 4th or 5th grade level in order for people to understand what does oral health even look like? How do I know that I'm healthy from an oral health perspective? What about oral cancer? We don't talk a lot about oral cancer. When we see kids vaping now and all the risky behaviors that kids can have that they don't really know, well, what's my impact to my overall health? So there's so many topic areas that I think we can share with consumers that really would kind of open their eyes about why is my oral health even important? Why should I pay attention to it?
Those are really, really great points, Ann. And certainly, the same thing happens especially now post-COVID or with COVID, health misinformation. I'm sure there's plenty of oral health misinformation out there, whether it's intended or not, just confusion around it. So going back to the basics and making sure people have health literacy is key. Laura, go ahead. Sorry, I'm curious what your answer to this question is.
Yeah, and I have an answer for it, but Ann, I will tell you, you are not responsible for it. I think it's prevalent in every healthcare profession organization I am affiliated with. I think, Shiv, if you thank you for asking the question. Coming to the professionals who come to you for education, one of the things that I'm seeing is that we could really benefit from education or courses on how to deal with patients of varying abilities. I saw a poster at a recent ADIA conference about the special needs patient. And, there are so many, and that's the special needs patient. There's so many other abilities that are varying, where we look at, if you go into a dental office and you look at the chair and you look at the way the room's set up, and just there's anxiety, there's mental health issues, there's anxiety issues, there's physical disabilities, there's cognitive disabilities. I think it would be wonderful to, and one video isn't going to take care of it all, but kind of that not only the empathy, but that deeper understanding, kind of stepping back and recognizing that treating patients with varying abilities takes a certain level of finesse and training and skills that I think people would benefit from.
Yeah, and the point Laura's making about mental health, Shiv, is so important. We just did a series of studies with the ADA Health Policy Institute, and mental health of dental professionals was one of the topics that we covered. And the high rate of anxiety and depression that really impacted them and their decisions to stay or how they're going to earn a living was a top priority, and leaving their income behind. But I don't think anybody ever realized, you saw a lot of it on the news about the healthcare professionals who were frontline workers and what their mental health status was. People didn't think about, wonder what the dental professionals' anxiety and depression rates are. And they were pretty high. So people who, were trying to battle their anxiety and depression were also part of the community that left because it was just too much.
Yeah, no, absolutely. Those are really good points. And especially the mental health care, the burnout, the stat you shared, Ann, at the beginning of, 8% of dental hygienists left the workforce, and unfortunately, many of them have come back. I know it from my own sister and brother-in-law about staffing, as well as, if you say you're a psychiatrist or OBGYN, certainly you're still on the front lines providing patient care, especially if it's not virtual or telehealth, and putting yourself at risk for contracting COVID pre-vaccinations, right? Or even now with vaccinations, breakthrough cases. But if you're in the dental profession, the only way you can provide care is if your patient isn't wearing a mask, if you're actually in their mouth, and if you're actually inspecting their teeth and gums and tongue, etc. And so that's even riskier. So clearly, there were issues there that need to be addressed.
Yeah. And I think the dental practices today that have a few metrics instilled in them will not have workforce shortages. So if you are running a dental practice or in a dental practice where communication is your top core value, you're going to do well. We learned through a lot of our studies how poor the communication was in dental practices. If you are really making sure that the appropriate PPE is available, in your practice, you probably aren't going to have a shortage. If you are up on your knowledge about what is a good compensation wage for dental assistants and dental hygienists, and you pay them well, and you express appreciation for them, you are not going to have a workforce shortage. It is so simple, it's scary. Respect them, pay them well, have good communication, keep all of that moving forward. You're not going to have a problem. But offices that don't, we heard crazy stories of dental hygienists who said, no, we haven't had any communication from our employer. None.
Wow.
Yeah, none. But then we heard the other side too, where they had team meetings, the hygienists met, the dental assistants met, they developed office protocols that were based on the CDC recommendations, and they were a team. That team stayed together. But if any one of those parts is missing, the teams tended to fracture.
I would just add one piece to that team. I completely agree with everything that Ann just said. And I would say investing in their education.
Yes.
And this is not self-serving, even though it probably sounds that way. But when you have organizations that are investing in people learning and growing and continue in their professional development, that means something to them.
Yes.
Yeah, absolutely. I mean, ultimately, everyone who works in a dental practice or healthcare system, they're a provider, they're an employee, they're potentially a patient, and they're a person. So treating them with all those hats is important. So I know I've already taken you 20 minutes over what I promised before, but a key question we like to ask, and the last question I'll ask both of you for your answers on, that our audience really benefits from, is what advice would you give to them about meeting their careers and approaching their careers in oral healthcare or healthcare in general?
Yeah, I think I would say, well, first of all, I would consider oral healthcare because there's so many opportunities and pathways and rewarding careers, jobs, environments in which to work. But most of all, I would say be your own advocate. Seek out opportunities to learn and grow. Expand your knowledge. And by doing so, it not only allows you to advance your career, but it can deepen your level of engagement and satisfaction in your work. Having a breadth of knowledge also makes you more well-rounded, in my opinion. And that's really powerful for a healthcare professional, which benefits not only you, but then the patients that you serve too.
And with everything that Laura said, which I agreed with, find that mentor.
Yeah.
Find that person that you can lean on for advice. I had them throughout my entire career, and diversify your experience as much as possible. We talk a lot here about get comfortable with being uncomfortable. You're not going to grow if you're comfortable all the time. So throw yourself into those experiences that you might not have ever thought you would thrive in. But that is the only way we grow, is to get a little bit outside of ourselves and try something new.
All that is excellent advice. And actually, coincidentally, Ann, just today, I was listening to a podcast with our CEO, Kumsal Bayezid, who'll be on this podcast in a couple of weeks. She's the CEO of Elsevier, as you may know. And she said the exact same thing. One of her first mentors at Bain, a consulting firm out when she was in LA, she told that person that she was feeling very overwhelmed by the work. And that person gave her some lasting advice that she repeated on the podcast, which is be grateful for that discomfort because it means you're growing. It means you're learning and growing. And so, finding mentors, understanding that careers are long. I mean, both your careers have wounded, and now you have this immense scale of impact that it's led to this. I know, Ann, you started off as a dental hygienist, and Laura, you started off in accounting, and now you both lead organizations that reach tens of thousands, hundreds of thousands, millions of people in aggregate. So I'd like to thank you both for taking more time than was allotted to join me on the podcast, and more importantly, for the work that you both do to raise the line and strengthen our healthcare system.
Great. Thank you so much.
Thank you so much, Shiv. It's been our pleasure.
And with that, I'm Shiv Gaglani. Thank you again to our audience for checking out today's show. And remember to do your part to raise the line and strengthen our collective healthcare system. We're all in this together. Take care.
If you like this podcast, please share it on your social channels. You can also subscribe to the series and check out all of our episodes at osmosis.org/raisethelinepodcast.